Howdy folks, welcome back to Trump and Media. Today we're going to be going over some of the COVID-19 death data from the CDC, and we're going to do some analysis on those numbers because I think you might be a little surprised, but I got to warn you, go ahead and strap in. This is going to take more than a few minutes to go over. There's a lot of numbers and a lot of information. And while there might be some answers in this information, the main point is just to kind of allude to there's a lot of misperception around the national perspective of what's going on. You know, a lot of people, they just look every day at the national numbers and they try to get an opinion on these numbers of what's going on in the entire nation. And when you break this down state by state, it gives you a much different picture. And to start, we're going to go over with something the president said yesterday, because he confirmed some statistics that a lot of us have known that have been doing our homework, but it's really hard to find because these states are not reporting all the data to the CDC. They're just reporting like little bits of data, like things like underlying conditions. They are not reporting underlying conditions that are included with these cases. Now, you could say that that's because, you know, some of these cases are being misreported. There's been a lot of evidence to allude to that, but here we actually have some confirmation on that, and I'm going to play this little clip from what the president said yesterday.
The median age of those who succumb to the China virus is 78 years old. Roughly half of all deaths have been individuals in nursing homes or long-term care. In one study, 90% of those hospitalized had underlying medical conditions, whether it's heart or diabetes, but usually it's some kind of a condition. It seems that people have that, and if they do, it's a problem, no question about it. Young adults may often have mild or even no symptoms. They won't even know they're sick. They won't have any idea that they have a virus. They won't have any idea at all. America's youth will act responsibly, and we're asking everybody that when you are not able to socially distance, wear a mask, get a mask.
Okay. Now, what did he just say there? So he said the median age was 78. 90% have at least one underlying condition, and 50% of those who died were in nursing homes. Now, I have personally seen studies where 90% have at least one underlying condition, and upwards of 77% have at least two underlying conditions. So if you do not have a major premorbidity, you're pretty much have nothing to worry about, especially if you're not anywhere near this age, this high age of 78. Okay, before I go over the data from the CDC, I want to qualify this data, and I'm going to read this. This is actually from the National Center for Health Statistics. These numbers are going to be a little bit lower than what you see on the news because these are based on death certificates. So these are more confirmed cases. You know, they have two sets of data. They got the data that they get on, initial reporting, and then they have a different set of data that is more verified, and which is used from death certificates. So I'm going to go ahead and read this to qualify this data. Note, provisional death counts are based on death certificates data received and coded by the National Center for Health Statistics. This was updated on July 20th. Death counts are delayed, may differ from other published sources. See technical notes. Counts will be updated periodically. Additional information will be added to the site as available. The provisional counts for coronavirus disease 2019, COVID-19 deaths are based on a current flow of mortality data in the National Vital Statistics System. National provisional counts include deaths occurring within the 50 states and the District of Columbia that have been received and coded as the date specified. It is important to note that it can take several weeks for death records to be submitted to the National Center for Health Statistics, processed, coded, and tabulated. Therefore, the data shown on this page may be incomplete and will likely not include all deaths that are occurring during a given time period, especially for the more recent time periods. Death counts for earlier weeks are continually revised and may increase or decrease as new and updated death certificate data are received from the states by the NCHS. COVID-19 death counts shown here may differ from other published sources as data currently are lagged by an average of 1 to 2 weeks. The provisional data presented on this page include the weekly provisional count of deaths in the United States due to COVID-19, deaths from all causes, and percent of expected deaths, i.e., number of deaths received over number of deaths expected based on data from previous years. That's important. Pneumonia deaths, excluding pneumonia deaths, including involving influenza, pneumonia deaths involving COVID-19, influenza deaths, and deaths involving pneumonia, influenza, or COVID-19 by the week ending date and by specific jurisdictions. Okay, Table 1 has counts of death involving COVID-19 and select causes by death by the week ending date in which the death occurred. For deaths, okay. This right here is national data. Now, they include this pneumonia and flu. We're not going to touch on that exactly. We're going to pay more attention to the total deaths and the COVID-19 deaths because, well, it's not really relevant for this conversation. So this right here is the national data by date, and I'll show you a graph of that here in a minute. And then down here, it's the totals by each state. Now, I also want to touch on this right here, these sub-notes. These are deaths with confirmed or presumed COVID-19. Confirmed or presumed. Okay, so not all of these deaths have been tested. They fall under this presumed, which I don't really want to get into right now. But if you're familiar with how, this code right here, that's where they go into detail on what a presumed death is, and that can be very vague. And a lot of people believe that a lot of the misreporting comes under this right here, under the presumed category. But just keep that in mind that these are confirmed and presumed deaths. It's the same for the state ones down here. The percent of expected deaths. This percent of expected deaths, this is based on an average of the last 3 years of what the average deaths were by percentage at this same time of year. So if you see here, here February around 101, our death rate for this year was really close to the average of the number of people that died in the last 3 years. Just to give you an idea of what that means. Okay, so here we're looking at the total number of deaths for the year. Total number of deaths is 1.4 million about. So this orange area is the total number of people that have died this year. And this blue area are the people that died or presumed to have died of COVID-19. And to give you a better understanding, basically for every one person that died of COVID-19, there were 11 other people almost that died of something else. So it's about 1 out of 12. It's 8.9%. And here, this is a timeline of all the deaths involving COVID-19. So here we start in February, and this is in March. And as you can see, this number is coming all the way down to the baseline again. So they, even though the news keeps saying that, we're entering another wave and everything, this is what the timeline looks like for the COVID-19 deaths. And that's assuming these are all being reported accurately. Okay, now we're going to look at this state by state, and this gets really interesting. We're going to start with this one here on the left. This is the total number of deaths. Now, you could speculate a lot of this is going to be based on total population. We'll take a look at that. But this here in blue is what we're looking at. That's the total deaths over the year. And as you can see, we got New York City, New Jersey. Now, this is all the states excluding District of Columbia and New York City. They got their own category. Here's New York City right here, and here's District of Columbia all the way up here. Now, again, these are total deaths, and I went ahead and compiled a top 15 list for these. So these are going to be your totals, and I went ahead and put, you can see here, like if you're wondering what the population is, here's the ranking of the total number of deaths, but in parentheses here, that is the ranking of the total population amongst the 50 states. So, you know, here you have New Jersey as the second highest death count, actually the first highest among states, I guess, not counting New York. New York's going to be number one, but New York City is separated here. But New Jersey is the 11th ranked state as far as population. New York is ranked 7, but it's number 1. Or, well, I guess this doesn't include New York City here. So Massachusetts is number 15 in population, but number 4 on this rank for total deaths. And COVID-19. These are COVID-19. These are COVID-19 deaths. So I also color-coded to kind of give you an idea of what the representation looks like. These blue colors are purely Democrat strongholds. The light blue is states that have a Republican governor but may as well be Democrat, like Massachusetts. I think the only Republican in the entire state there is the governor. Same with Maryland. And Ohio here is pretty much Democrat. All the major metropolises are Democrat. These purple ones here are very mixed as far as Democrat and Republican, as you know, amongst federal representatives and mayors. Texas, you know, the state capital has a Democrat mayor, and a lot of the major metropolises have Democrat mayors. Same with Florida. A lot of the metropolises have Democrat mayors. Indianapolis has a Democrat mayor, which makes up the majority of the population there. So these are the top 15 of total deaths, and these are the bottom 15. And I did the same thing here with the parentheses. So higher numbers are good here. Higher numbers are bad up here. Higher numbers are good here. So Wyoming, which has the smallest population, is number 2 on total deaths, so that makes sense, right? But you have stuff like Utah here, which is number 21 on the smallest population, is 11th on total deaths. So higher numbers mean they're doing a better job here at reducing deaths there, or they could possibly misreporting. Who knows? Like we'll get to some of that in a minute. I think there is definitely some evidence that there is misreporting going on in the positive and misreporting going on in the negative. All right, this next chart we're going to look at, this is per capita. So this is per capita for every 100,000 people. You can see Hawaii has 1 for every 100,000. New York has 243 for every 100,000. And the median here, I also kept track, the median's 18.67. So the median is going to be right here at South Carolina. And here we have the top 15 per capita deaths. Okay, and you can see what their per capita numbers are right here. And that's compared to the median, which is 18.67. And here we have the lowest per capita. And I put these asterisks right here so that you can distinguish which of these 3 are different from these 2 lists, because I think this is the most important. You can look at these total deaths and say, oh, well, you know, that's because they have higher populations. Well, if you look at per capita, that's a little true, but there are some in here that have very low populations. Like over here, California is actually doing really well. as far as total deaths. They've got the highest population for a state, but they only rank 6th on total deaths, and they're not even listed here on per capita. Same with Florida and Texas. So you can see that. So the first, second, and third ranked state for population aren't even on the highest top 15 for per capita deaths. You got District of Columbia in here, Rhode Island, and Delaware up at the top of per capita. And for the lowest, as you can see here, these are different also. I put stars next to the ones that are different. So you can see that for higher populations, these states are doing really well as far as per capita. Tennessee, Oklahoma, Texas. And if you're wondering what these colors are, the very red ones are Republican strongholds. Montana is the only pink one I got, I think, because it has a Democratic governor, but pretty much the whole state is Republican. Vermont, like the only person in that state that's a Republican is the governor. That's where Bernie Sanders is from. And Utah has a Republican governor, but a lot of the major metropolises have Democrat mayors. So I put that a lighter shade. And this is just to kind of give you an idea of which party mainly controls these states. And again, the purples are very mixed. All right, the next one we're going to look at is the percent of all the deaths that are COVID. And that's kind of like that pie graph I showed earlier. That's the national, COVID versus, this percent right here is 8.9. So about 9%, almost 9% of the total. And this is looking at that by state. So out of all the deaths that were reported this year, this is the percentage of those deaths that were COVID-19. And as you can see, New York City is our number one taker here again at almost 40%. So almost 40% of all the deaths this year in New York were COVID-19. New Jersey coming in at just under 27, Connecticut 25. Here you can see those numbers. So this is the percent of all the deaths in the state this year that were COVID-19. Now, I think this is a little fishy right here. This is really to point out which of these states need to be investigated for their data reporting. If you look at these numbers, and I'm going to show you at the end of this video the CDC map and trend lines of the last 4 to 5 years on flu and pneumonia, which is really going to point out how some of this stuff has to be misreported. There's just no other explanation for the deviation on some of these numbers. So here's the top 15 for the percent of all their deaths being COVID-19. And here's the bottom 15. As you can see, the median is about 4.5%. And we'll go to the next one. This is the total percent of expected deaths. Now, this is compared to the average of this time last year, compared to this time of year, the last 3 years, 2017 to 2019. They take the average of what the total deaths are at this time of the year and then compare that to the total deaths this year. So New York City has 200% over the average, so 100% over the average. So that means that there has been twice as many total deaths for this time this year as compared to the last 3 years. 2 times the amount of deaths, which is a lot. And the median for this is 100.5. The CDC put out an article at around the beginning of May that even with COVID-19, we were still running a little bit under the expected death rate, which I think is really important to note. So even now, after a lot more deaths have been reported, the median is still really close to normal. And I said at the very beginning of all this, with the lockdowns and everything, that we would probably be expecting a lower death rate. I mean, not counting COVID-19. The fact of the matter is that people die from living. Okay, so if you have everybody on lockdown, that means there's going to be less car accidents. There's going to be less accidents, work-related accidents, people drowning, just everything across the board. People die from living. So if nobody's out there living, that's going to, and especially the hospitals too, they'll never admit this, but the few times that there have been recorded hospital strikes on the planet, death rates drop dramatically. So you got no one going to the hospital and no one going outside. You would tend to think that the death rate for normal deaths is going to drop somewhat significantly. So even with the COVID numbers and everything, our median here is still really close to 100%. And you can just take a look at the deviation here, especially in this top 10. And, again, in my opinion, these states need to be investigated. This is really, really strange to have such a deviation like this. And also, I think on the lower end, it's a little weird too. You have these top three, 80%, 90%. This is on the lower end. You'd expect these numbers to be somewhere in this area or a little higher. This should not deviate that much. So I find this a little. I mean, Alaska. You could argue that Alaska might have less, especially if everyone's on lockdown, because it's so remote. But this is really strange. So again, this is total deaths. Now, this is where it gets really interesting. Over here, we have the same thing, but you take COVID out of the equation. So this is our expected deaths without COVID. So taking COVID completely out of the equation, New York City still has 21% more deaths this year than on average for this time of year, which, I mean, that right there, like, what is happening in New York City? Seriously. It's also very strange for Arizona. As you can see, the deviation is not quite as pronounced here because this is without COVID-19. But I just found this really interesting because these numbers here should be pretty low. As you can see, the median here, even without COVID-19, is close to 96%. So you would expect most of the numbers to be pretty close to that. And just to give you an idea, 96% is somewhere around here. So as you can see, most of the states are somewhat close to that. But once you start breaking off, I mean, if you look up here, Connecticut, North Carolina, West Virginia, that is really strange, and especially way down here. So here's the top 15 and the bottom 15 for these ones. I think all of these states right here deserve investigating. Every single one of them, for the low numbers and the high numbers. Now we're going to look at the CDC flu data. Okay, now this I find fascinating. Now you can see here, this is pneumonia and influenza mortality surveillance from the National Center for Health Statistics, CDC. And this goes back to the 2015-2016 flu season. Now you'll notice there was an outbreak here in 2 years ago. I think that was the H1N1 that everyone talks about. But something I want you to notice here, now I know that the outbreak of, this includes COVID-19 pneumonia and flu, by the way. This includes that. But if you'll notice, even with this spike, it still follows the baseline here and comes down below. Now here you could attribute that to the outbreak started later in the flu season for us with this COVID-19, but this is still really weird how, right here where the baseline usually goes down, this thing spiked up. This red line here is the percentage of deaths that is from pneumonia and flu. And if you've ever dealt with these numbers, pneumonia makes up the vast majority of that, like 95% or so. So the flu, you can almost take flu out of the equation because they usually die of pneumonia. So this is the national view here. And you might be, just like with the other stuff, you might be able to look at the national view and maybe apply some logic to this spike right here. But when you break this down state by state, it looks really weird. Really, really weird. And we're going to take a look at that. Just to give you an example, this is Washington here. Okay, let's take a look at two states right next to each other. Okay, these are northern states. You're going to see higher rates of pneumonia and stuff over here. Let's look at Wisconsin. Wisconsin, which is primarily Democrat, okay. If you look at this is actually a downtrend, and the other thing, you'll notice that these spikes here, normally they're in downtrend here, but a lot of the spikes are a little later in the flu season than normal. But even for Wisconsin, this looks fairly normal. Now let's take a look at Michigan. What the hell is going on in Michigan? Okay, please explain to me how you can go from this right next door to this. And now you're going to see a deviation like this in a lot of states. And I'll click on some of these just to give you an idea. In some of the states, it'll mimic like some of the previous spikes, like here in Nevada. California looks somewhat normal. The only difference is how late in the year this is. But, you still might be able to hypothesize that this is okay. Wait till we get to Arizona. That's going to be the kicker here. So there's Texas. And Florida looks really strange too. There's two states that really, really deviate later here in the year. Florida, which is still almost on this uptrend, hasn't quite broken out of this uptrend yet, even though it's fallen down from that spike. There's two states, Florida and Arizona. Wait till you see Arizona. But I just want to show you some of these states, how a lot of these will look normal. Yeah, this is also strange for North Carolina, for this to still be in an uptrend like this. These states, this is what, Trump would call fires. Like, this doesn't make any damn sense that this would still be in an uptrend like this. As you can see, most of the states are falling down. And I still think that these charts just show some weird stuff. Here it's normal. There it's normal. Now let's go look at New England. New England looks like this. New York, of course. Here's New York. New York City. And then you go right next door to like Vermont. Vermont looks normal. New Hampshire looks normal for the most part. Maine even normal. Even, let's go to Massachusetts. Massachusetts. What the hell is going on in Massachusetts? New Jersey. Look at this for New Jersey. Now, so you can see how, especially some of these major Democrat states, just are so different in their numbers and with the flu and influenza than the Republican states that are right next door, or even somewhat Democrat states that are right next door. It's really weird. I would really like to see an explanation for that. Now, to me, the strangest thing out of all of these, you have a deviation from some of these states that are really strange, but when you come over here to Arizona, what is happening in Arizona? Look at this. Why is the flu the flu season's over? I was looking at data where they keep track of flu seasons. They don't even keep track of the numbers at the bottom of these baselines. Like when you go back to the national one here, this baseline, like during these weeks right here at the bottom, a lot of places don't even keep track of that data because it is so insignificant. They keep track of the data through these ranges. So please tell me why that we are now approaching the bottom of the baseline, and you've got states like Arizona that is peaking for flu in one of the hottest states of the country. It literally, some people have said, oh, it's because they're in air conditioning. Well, I don't believe you. I don't believe that's the case. Even Louisiana, which most people rely on air conditioning there, here it's really hot and dry. Here it is extremely hot and has the highest humidity. I would never live here. It is so uncomfortable. And look at this. We're all the way down at the bottom, but you come over here, and it's peaking right now. This right here makes no sense at all. Like, we should have every scientist in the world in Arizona studying what the hell is happening over here. Okay. So anyways, I just wanted to point out this particular set of data because this shows such a deviation in numbers and deviations that require answers. I mean, real answers. There should be massive amounts of scientists and stuff studying what is going on with these deviations. And that's about all I'm going to cover in this video. I might do another video breaking down some of the state-by-state figures. I don't know, it's kind of exhausting going through all this stuff. But hopefully this will give you a little bit better of a picture of some of the shenanigans that are going on. Because, there's massive financial incentives for federal funding with the reporting of cases and deaths. And, we're all familiar with shenanigans that have been going on in the medical industry for decades, between insurance companies and, overcharging for, you got the pharmaceutical companies and all this different stuff. And everyone knows how corrupt, I guess, for lack of a better word, the medical industry has been for many, many, many years. And it's like people expect that just to change all of a sudden when you've got the feds offering large sums of money for COVID cases, hospitalizations, ventilators, and stuff like that. And especially considering the fact that in the beginning part of this year, the hospitals were all shut down. Or, they weren't allowing any other services other than COVID-19. You had hospitals all across the country that were completely empty, furloughing employees. I saw people reporting that, some hospitals were fearing being permanently closed because they weren't allowed to do any other care, and there wasn't anybody coming in for COVID-19. So it would not surprise me that a lot of people were fudging the COVID-19 numbers just to get some money into their hospital to keep from having to close down or furlough employees. And, I don't know if any of this is ever going to get investigated, but I guarantee you if it did, there would be a lot of shenanigans being reported all over the place, especially I hate to say it, but some of these blue states look really suspicious. So anyways, that's all for today on this topic. Hope you all learned something and maybe got a better picture as to what's really going on in this country.